Hi, Marissa. Good seeing you today. I'm excited that we're here to talk about the regional networks and the injury and violence prevention. I think we both served on the leadership team for the Southeastern and Southwestern region. You've been around a little bit longer than me. Can you tell me a little bit more about the network?
Sure. I'm happy to share. Hi, Josette. I'm happy to share what I do know. I haven't been involved that much longer than you have, but um, what I do know is that there are 5 regional injury prevention networks. In 2012, through the core state injury and violence prevention program funding, the CDC funded one state health department in each of the 5 regions to coordinate the regional networks. And then 2 of the regions have been around a little longer. So the Southeast by Southwestern region has been around 30 plus years, along with the Northeast and Caribbean region. But in 2021, the CDC decided to transfer the facilitation of those 5 regional networks to the Safe States Alliance. So that I was involved, I was, around and remember seeing that transition. So aside from those 2 regions that have been around for a long time, we also have the Western Pacific region and the Plains to Peaks region and the Great Lakes and Mid-Atlantic region. So aside from that, I think the only thing I can add is I've found the networks to be really helpful in collaborating with folks, learning from people, building partnerships. And so I've just found that that's been helpful for me in some of the work that we've been doing. So anything that you found helpful during your time?
I have to agree with you. I've found that I've had opportunities to exchange information with other team members doing prevention work. Our partnerships have grown to learn networking, and we've also been discussing in our network in the Southeastern region, we've been discussing social norms, network mapping, and communications. And this has been like a wonderful thing to be a part of the network.
Yeah, no, I agree. I feel like I've been in the injury prevention field for 15 years, and it's hard to believe, not just saying that because it doesn't seem like I've been in that long, but 15 years working locally in the community, and now, transition to do more state work. It's been helpful, and being part of the network really opens your eyes to what others are doing, similar work that we're working on, but at the same time, similar challenges. And so I think that's also helpful because you realize you're not doing this on your own. A lot of folks are going through some of the similar challenges we're going through with staffing and things like that. But anyway, it's been helpful to foster relationships in those kinds of ways. So yeah, and I think I don't know, I really enjoyed learning, as you said earlier, learning about being involved with like the hip sig. Like I was involved with a hospital special interest group before, and that when I used to work in a hospital, and that was very helpful because you realize some of the similar work again. But being part of the leadership group last year, I served as a secretary last year. It also helped me not only network with folks, but learn about the network itself. Like, what are the networks doing? What direction are they moving in? And that's been helpful to guide our work at the state level too.
And I have to agree with you. I'm a new injury prevention worker, and I call this my birthing years. This is like year number 2 for me. So joining and being a part of the network, I'm able to grow, uh, learning so much, being able to network. Like right now, the network mapping, and that's part of my interest is network mapping and how it works, and even communication. Just like, are we out here effectively communicating, saying the right language when we're out here talking about my program is rape prevention. And so when we're out here talking about these programs and educating and preventing, am I doing the right language? And this has been such a wonderful thing to be in the network. And even when I'm talking about health equity, and there's places I can go and piggyback off of other states and see what they're doing. I really enjoyed being a part of the network.
Absolutely. I think sometimes when you're working in a smaller department or, with other folks that are not directly in injury prevention, but maybe in some other related fields, best practice. We talk about best practices and what are those and how do you incorporate those into your culture? And health equity, like you mentioned. I mean, yes, we talk about it. We want to do that work, but then how do we do that work? Like, how do we transition from the norm, what we've known before, to this new way of thinking, and this new way of implementing programs? And so I think that's a lot of folks are interested in learning that. And I think working together with folks, having those conversations is a great way to start in that movement. So I'm excited, and I've loved being part of not only Safe States, but being part of the networks, because it's a great opportunity to learn from others that are been in the field for so much longer than I have. And even though I have 15 years experience, there's still so much to learn. And so I think it's always fun. It's always fun to network and get to learn from others.
Right. Marissa, so I hear about the other regions are we're planning on having a joint meeting in July. Are you planning on attending?
Yes, absolutely. I always try to, take those opportunities when they're having like open discussions like that, to be a part of it and learn about new ideas and initiatives that the network is working on. So yes, definitely.
I think it's going to be pretty fun. It's going to be all 5 regions. So I'm interested to hear like what everybody is doing, the climate change, everything. I'm
Yeah,
interested in seeing how all of this tie into prevention work.
absolutely. I think that's unique because I've been part of the network and I don't I don't think they've ever, I mean, as far as the time that I've been on involved in a joint meeting like that, I haven't not participated before. So I'm interested and look forward to it.
And it's always interesting to hear like other regions doing, what are they doing on health equity. We know that this is
Absolutely.
going on the move. It's a big push into prevention work. So what is everybody doing? How are they incorporating the health equity? Um, I think this will be a great time to network and figure out and who we can piggyback off of,
Exactly.
incorporating it into our program.
I agree. I agree. I'm always looking for those new ideas and then working at the state level. Sometimes it gets a little hard to bring in new ideas and get buy-in and implement some of those things. So I'm definitely looking for those opportunities for sure.
I have to agree with you. I agree.
All right. Well, I look forward to seeing you there, Josette, if you participate as well. And I hope to touch base with you again sometime.
Okay, and I look forward to seeing you, and I also look forward to seeing you at the National Safe Space Conference in Colorado.
Awesome. Yes. Thank you, Josette.
See you then.
All right.
Good
Bye-bye.
talking to you. Bye bye.
Likewise. Bye.